everybody. Welcome to my YouTube channel. Welcome to Healthy Lifestyle Matters. Yes, indeed, Healthy Lifestyle Matters. Welcome to another episode of Health Talks. So, my name is Stephanie Agbonkwae, but I'm popularly known as Daughter of Zion, the Most High. I'm so blessed to be called Daughter of Zion. Thank you for watching. Thank you for tuning in. So today we're gonna be talking about another health topics, and who's gonna figure out what our topic is? Excuse me. I'm sorry. Excuse me. So did I say something? No. Oh, so today we're gonna be talking about yawning. Okay. We're going to be talking about yawning. Of course, we're going to define what yawning is. And I'm going to answer some FAQ question and answer. Is yawning contagious? And, causes of yawning, and also we're going to talk about treatment of yawning. So, guys, watch this video to the very end. A lot of people have this controversy. Is yawning contagious or is yawning not contagious? So it's a whole everybody's thinking about what to say. But today I'm gonna be talking about yawning. Sorry, I'm trying to demonstrate. So today I'm gonna be talking about yawning. So stay tuned to the very end. Let's start by defining what yawning is. So defining what yawning is. Yawning is an involuntary opening of the mouth accompanied by slowly breathing inwards, then outwards. I'm going to repeat that again one more time. Did you catch that? I'm going to repeat that again. So what is yawning? Yawning is an involuntary opening of the mouth accompanied by slowly breathing inwards, then outwards. So that is what yawning is. That's the definition of what yawning is. So one thing that I want you to understand is that yawning does not only occur in human beings. Animals do yawn, just in case you don't know. Let me tell you today. Animals do yawn. Yawning is something that happens to everybody. Yeah. So it can happen to human beings, like you and I, and it can equally happen to animals, like dogs, pets, whatever. So yawning occurs in human and also with animals. So that is what yawning is. Definition of yawning. Yawning is an involuntary opening of the mouth accompanied by slowly breathing in, then outward. So now let's talk about why do we yawn in the first place? Let's start there. I know this is somehow funny, but we're going to talk about it, huh? Yeah. So why do we first of all yawn? When we talk about why we first of all yawn, like what causes or what trigger us to yawn, let's talk about the causes of yawning. What is going to trigger you to yawn? And then after talking about the causes, of course, I think I'm going to talk about if yawning is contagious or not. So stay tuned to the very end. Make sure you watch the video to the very end. So let's talk about causes of yawning. What is going to cause you to yawn? We have a lot of factors. Some yawning are triggered by fatigue. Some are triggered by trauma. Yawning, another cause of yawning is that yawning is triggered by sleepiness or fatigue. We also have epilepsy. Yeah, epilepsy. Some of the causes of yawning, excessive yawning. We have epilepsy. We have sleep disorders. We also have side effect of certain medication can cause you to yawn. We have sleep disorder. We have brain tumor, failure, heart failure. We have brain tumor. We have epilepsy. We have drowsiness. We have fatigue. We have sleep deficiency. That is, your inability to sleep. And also we have what you call a condition where you see somebody yawn and then you automatically feel as to yawn. And we talk about that can cause you to yawn. Also, your body inability to control its body temperature is going to cause you to yawn. Also, yawning is another way of telling people how you feel. For example, if you keep yawning, it might mean that maybe you always sleep or you need to go to bed. And then also, yawning can also be, yawning helps you, stretch out your lungs, which is a very good thing. But we're talking here about excessive yawning. So another cause of excessive yawning can be hungry. I know this sounds surprising, y'all, but 7 out of 10 people, when they're hungry, they get to yawn a lot. So we're talking about excessive yawning. So another cause of it is hungry. Some of them is bored. When people are bored, they tend to, sitting in a particular position for too long, boredness, anxiousness, excitement, all of that can be a cause of yawning. Yawning also is a protective reflex that helps to distribute a substance called surfactant. Surfactant helps you to distribute. Yawning is it helps you to lubricate the brain, because yawning is a substance that helps you to lubricate the brain through surfactants. So it's gonna help you to lubricate the brain. Also, yawning helps the brain, cooling down. It's a cooling mechanism for the brain, especially. So yawning has a good part, and when it's excess, that is when there is a call for concern. So yawning, like I said, is triggered by a lot of causes. We talk about a lot of side effect of certain medication, and precisely medication that has to do with depression and anxiety, can cause you to yawn a lot. And then we also have medical conditions such as epilepsy, heart attack, heart failure, tumor, you name the way. So you want to watch out for that to make sure that that is not the cause of you yawning too much. Also, yawning is a brain cooling mechanism that helps with alertness. Yes, let me repeat that again. Yawning is a brain cooling mechanism that helps with alertness, for you to be alert. So talking about yawning is going to help you to lubricate your lungs. Yes, yawning is going to help you to lubricate your lungs. Now let's talk about if is yawning contagious or not. What do you think? Let me listen. Is yawning contagious or not? The answer is yes. Okay. Yes, yawning is contagious. Okay. You want to know how? Yes, yawning is contagious. Let's talk about contagious yawning. Yes, I did say yawning is contagious. How? Let's talk about the contagious part of yawning, or the contagious yawning. Contagious yawning is triggered by a stimulus, a specific stimulus. Contagious yawning is triggered by a specific stimulus called fixed action pattern. Fixed action pattern is a stimulus that is triggered when you see somebody yawn. You have this urge to yawn. It's a stimulus, and you cannot control it. Some people, this stimulus work with them. They immediately hear the sound of somebody yawn, like they just start feeling as to yawn. So yawning is contagious. And how is yawning contagious? Let's talk about the contagious part of yawning. Yawning is contagious because it is stimulated by a specific stimulus. It is triggered by a specific stimulus. And what happened is this: yawning, as we all know, that is triggered by a specific stimulus. When this stimulus occur, this stimulus is called fixed pattern action. When this pattern occur, when you see somebody yawn, you have this urge to yawn. Not because you can control it, but because you see somebody or you heard somebody yawn. That is what we call, contagious yawning. So yawning is contagious because it is triggered by a stimulus, a specific stimulus called fixed action pattern. This is the inability of you yawn, I yawn. I see somebody closer to me yawn, I feel like to yawn. And also, I would say this type of yawning occurs mostly with people surrounded by you or your loved ones. There is a tendency that you get to yawn a lot when you see someone closer to you, like your loved one, your family, your husband, your wife, your spouse, yawn beside you. You have this urge to yawn. And bear you with me, it is not you that is causing it. It is a stimulus that is being triggered just because you see somebody yawn. Remember this, I always tell you all this. What our eyes see has the ability to transfer to our brain in order for actions to take place. That is the same urge that when you see somebody, like, let's talk about domestic violence. When you see somebody beating somebody or hitting somebody hard or hurting somebody, you feel like you always want to help to make sure that person is not hurting. That is your humanitarian nature that is trying to come out. Same with yawning. And with yawning, it is triggered by a specific stimulus. This is what happened. When you see somebody yawn, it triggers this stimulus in you that makes you or cause you want to yawn. So by doing that, we say yawning is contagious. There are some people that they don't really need to see you yawn. Just the sound of the yawning sign cause them to yawn. For example, I know when I make like, I know some of you might be there wherever you are, you might feel like you want to yawn. So that is how we know yawning is contagious, because it is, this thing of I see you do this and I want to do it. I see you doing this, I want to do it. So that is how yawning becomes contagious. So yawning is contagious. There are, two types of yawning. I think we have contagious yawning and we have willing, like on your own, where you just see you want to imitate somebody. And then contagious is when you see somebody and you'll be like, oh, you start doing it before you don't even know you're doing it, but you find yourself doing it, So yawning is contagious. Yes, it is contagious. Your inability, when you see somebody yawn, it triggers that stimulus that is in you. Yes, it's a specific stimulus that when you see somebody yawn, just the act of or the fact that you see that person, it triggers that stimulus that is in you and it causes you to yawn. So that is what contagious yawning is. And of course, yawning is contagious. So the next question that I have on my inbox is, can you stop yawning when you feel like, can you stop yawning in the course of you yawning? Like, if you want to be like, can you stop? So somehow it is impossible for you to stop yawning once you've already started. I don't know if I make sense, but it's impossible for you to stop yawning once you've already started, because once you've already started yawning, it has to go. Remember, by our definition, we say, what is yawning? Yawning is the involuntary. What do I mean by involuntary? Involuntary means something that you cannot control it. Let's start there, okay? So, yawning, can you stop yawning in the course of, can you stop yawning once you already begin yawning? It is impossible for you to stop it. Let's start by defining yawning again one more time so you have a clue of what I'm talking about. So yawning is the involuntary opening of your mouth. What do I mean by involuntary? It means you don't know, it's not something that you can control. Voluntary is when you can control. For example, your skeleton, your hand is voluntary, because I might decide to raise up my hand and I might as well decide not to raise up my hand. So your muscles is kind of a voluntary muscle. Your skeleton, that is your hand, your legs, it's a voluntary muscles. But something that is involuntary is something like your heart. You cannot, tell your heart when to pump blood and when not to. So let me get that clear first. So when we talk about involuntary, it means you cannot control it. It is impossible, or you cannot control it in a simple way. You cannot control it. So is it possible? The answer of is it possible for you to stop yawning once you've already begun is impossible. Because remember, at this time, you are not the one in control of it. We talk about a stimulus. It is a specific stimulus called the reflex specific action pattern. Once you've started, you cannot stop it. So it is impossible for you to stop yawning once it has begun. So that answer is impossible. You cannot stop it on that side. Now let's talk about non-conscious mimicry. Non-conscious mimicry is when you imitate somebody. This process is talking about much about you, learning. So non-conscious mimicry is when you try to imitate somebody. For example, maybe your 2-year-old daughter, your 2-year-old child, might see you doing something and they want to imitate you. That way, they are not doing something that by so doing, it is not something that is, that happen, they willingly want to, let me put it, it's not something like, the one that is contagious, but this time around, you see somebody doing something and you want to do it. I call it copyright. When you want to imitate somebody. So non-conscious mimicry is when you want to imitate somebody. Okay, just because you see somebody yawn, you also want to yawn. So that's what we mean by non-conscious mimicry. Because the thing is that you're doing it without you only find yourself doing it. But you were copying from somebody. It's like you see somebody doing something and then you want to do it, and you don't know that you're doing it until you've already done it. I don't know if any of us have experienced that in our life. So that is what mimicry is. That is what non-conscious mimicry, talking about yawning. That is what it is. When you see somebody yawning and you want to imitate that person. Not that the yawning comes on its own for you, but because you see somebody yawning and you want to definitely imitate that person. So that is a non-conscious mimicry. So you trying to imitate that person, the yawning does not come like from you, like something that is natural like for everybody. Just because you see somebody yawn, you want to imitate. Just like a child will want to imitate you when you do something, whether it's good for them or not, they just want to imitate you because they see you doing that thing, not because they know that that thing is right or wrong. Yeah, this is possible because of a specific neurons in our body called the mirror neurons. What does mirror neurons does? What it does is this: when mirror neurons, it's a brain cells that helps equalize something. For example, if you see someone performing an action you want to do as that person. So with yawning, it is considered mirror neurons because of the specific neurons called mirror neurons that helps you. It is a brain cells that helps you to see something and want to do it. And this helps with learning, the process of learning. That is how we all get to learn. We see someone doing something, we want to do it. So it is a brain cells that helps you like trying to practice what you see others doing. And also, let's say for example, a good example is makeup. You see someone doing makeup, you try to imitate. What is helping you to imitate that person doing makeup, or to try to follow the steps that person is using step by step to do that makeup, is the help of the mirror neurons, which is a brain cell that helps you to perform tasks due to the fact that you see someone doing that task. So we applaud mirror neurons for that, for doing a great job in our brain, because if not of it, learning was not gonna be possible. So mirror neurons helps you to is the ability for you to see someone doing something. For example, you see someone knitting, right? Like baby wraps or whatever. You see someone knitting, you see someone doing makeup, you see someone sewing dress, you see someone doing something, carpentry, anything. You see someone doing something and you want to, learn how to do that thing. Or you are able to help to do that thing or want to do that thing because of the helps of mirror neurons. So it is a brain cells that helps you to function just like what you see somebody else's in the outer world doing. So you want to do what you see someone doing. It helps with learning and also self-awareness. So thanks to mirror neurons, specific neurons in our brain cells, that helps us to try to learn from what we see others doing. Also, we also have neuron imaging studies, fMRI, neuron imaging studies with the help of fMRI, which is functional magnetic resonance images, shows that we have these specific neurons in our body that when we see someone, doing something, we have this urge to do it. So neural images with the help of fMRI, which is functional magnetic resonance imaging, shows that in the human body or in the brain we have these specific neurons, the neurons that I just mentioned. What does that neurons do? That neurons, when you see someone yawn, it passes it to your brain that, oh, you see someone doing this thing, try to imitate to do it. So these are all points to back up the fact that yawning is contagious. So all of these points I am listing out is to give you reasons to believe that yawning is contagious. Whether you believe it or not, it is contagious. A lot of research has been done, a lot of tests, examples have been conducted, and it's been proven that yawning is contagious because of neurons, specifically a specific neurons called the mirror neurons. And also we have neural images with the help of MRI, which is a functional magnetic resonance imaging, shows that you have these specific neurons in your brain cells that when you see somebody doing something, you feel the urge to do that thing. Thereby, you might not only see somebody yawn before you feel like to yawn, just the sound of the yawn itself might cause you want to yawn. For example, if I say, just the sound of the yawning is going to cause you to yawn. I believe some of you are already yawning just because you see me yawning. So yawning is contagious. All of this is just summing up the fact with proof that yawning is contagious. Let's talk about the empathy side of yawning. Empathy is your ability for you to see someone in a situation and you understand and you want to partake in that person's emotion. You want to see as, try to help. Let's talk about the empathy part of yawning. Yawning, like I said, it's a way that somebody will communicate to you. Causes of yawning is a way that somebody communicates to you how they feel. So let's talk now about the empathy side of yawning. Empathy is the ability for you to understand the pain and the feelings of what somebody else is going through, and you try to partake in their emotions, how they feel about it. So with the empathy side, neuroscientists have discovered that we have a subset neurons in our brain, in our body, that makes us want to help when we see somebody in a situation. Now, relating that to yawning, when you see somebody yawn, for example, you see a child just sitting in a chair and yawning helplessly, you feel for that child to the extent that whenever that child yawn, you want to yawn too. So, what am I saying? All of these are backing up the fact that yawning is contagious. Yes, it is contagious. Talking about the empathy side of yawning, the ability for you to see someone going through feelings, emotional feelings, or whatever be the case, going through some sort of feelings or some sort of moods, and you want to partake or see how you can help them. That's the empathy side of yawning. Now, talking about relating that to yawning, like we said, when you see, for example, you see a child sitting down helplessly, maybe sick or inability to take medication, but the child needs to take that medication, and the child is helplessly sitting, yawning. To some extent, mothers can bear with weakness. To some extent, the mothers or somebody closer to them, seeing them going through whatever they're going through, want to help. And in such cases, even when the child yawns, they also feel like to yawn. These are all facts because it has been proven by neuroscientists that we have these specific neurons in our body that helps to stimulate whenever we see circumstances around us that triggers the neurons. It reacts because it cannot stay. That's the function. So all of these points are telling you that yawning is contagious. It is contagious. So next time somebody sit around you and start yawning, you want to watch out because you're going to be yawning too in a little bit. So you want to watch out for that. If you're sitting around somebody yawning, and yawning is really effective. Contagious yawning is really effective within friend zone. Your sisters, your friend, your spouse, anyone closer to you. When they yawn beside you, there's a high tendency of you trying to yawn or yawning without even knowing because someone closer to you just yawned. So yawning is contagious. Now let's talk about diagnostics of yawning. So talking about diagnosis of excessive yawning. Yawning, like I said, can be triggered by a lot of things. So talking about diagnostics of excessive yawning. So the first thing is to see your doctor. You always know, I always talk about seeing your doctor because, you wouldn't know if something is wrong if you don't find out. So talking about excessive yawning diagnosis. First, when you see your doctor will want to go over certain things to you, like, medications to make sure that your excessive yawning is not due to a side effect of certain medication. Like I did say, medication for depression, anxiety can cause you to yawn a lot. So if you're taking medication for anxiety, depression, or anything of that nature, talk to your doctor because your doctor will go over all these. Talking about diagnostics of excessive yawning, your doctor will go through all of these. Is it your medication? Is it sleep disorder? And if it's sleep disorder, your doctor is going to help you in one way or the other, with medication, with sleeping devices for you to have a good sleep. And also your doctor will talk to you about hungry. Are you yawning because you're hungry, you want to eat? After the doctor must have gone through all of these side effects of medication, and if it's not the cause, your sleep routine, sleep schedule, if it's still not the cause of your excessive yawning, talking about hunger, boredness, trauma. If your doctors have gone all through all these and it's still not the cause of your yawning, then they might do a test for you called the. If your doctor have gone through all of that tests and it still don't work, your doctor is going to conduct a test through a test called electrophallogram. Electrophallogram is an electric device that it's an electric device that monitor your brain and activities of your brain, and it's gonna check for medical conditions such as epilepsy or any underlying medical condition. So this device is gonna help to detect. They're gonna put it in your brain, and it's gonna help to detect any brain failure, any medical underlying medical conditions such as epilepsy, check for other things that might disrupt you to yawn, or it's gonna cause you to yawn a lot. And if your doctor have run this test and it's still not, she didn't see any epilepsy sign, any underlying medical sign, then they might further the test to an MRI test. So the Mroi scan is a magnet. It's a magnet that produces. It's a magnet and also a radio wave that produces scanning in your brain. They're gonna put the Mroi scan in your brain, and it's usually it's in your brain and your spinal cord, and it's gonna give a picture of your details in your body tissue. And when it gives these pictures of details in your body tissue, especially the brain and the spinal cord, your doctor will be able to visualize what area is affected. Is it your brain? Check for medical conditions such as multiple sclerosis, and also for epilepsy. Your doctor is going to run all those tests with the help of Mroi scan, because it's a magnet and a radio waves magnetic scan that when they put it in your body, it gives a picture of the various parts or structures of your body, and your doctor will be able to visualize which body part is being affected, and if your brain or any other part of your body is being affected, which is causing you to yawn. And they're going to check for underlying medical conditions such as epilepsy, brain tumor, brain failure. They're going to check. That Mroi scan is going to help your doctor to visualize where the excess yawning is coming from. And of course, those are some of the diagnostics when it comes to excess yawning. Yeah, and then now let's talk about the treatment of excess yawning. So now let's talk about treatment of excessive yawning. So if you're excessive yawning, after the doctor must have done all of these tests, the Mroi scan and the rest, after your doctor must have done the diagnostics, and let's talk now about the treatment of excessive yawning. If you're excessive yawning, if they find out that it's being caused by side effect of certain medication, then your doctor might recommend reducing the dosage of that medication. And please, I haven't said because you're going through all of this you should stop taking medication. You want to check first with your doctor if it is okay for you to continue taking this medication, or they need to change your medication or anything. So you want to check out for that. And also, please, if it is due to sleep disorder, because some people yawn because of sleep disorder, if it is due to sleep disorder, then you want to talk to your doctor, because they might give you a sleeping device that might help you to sleep well. They might give you sleeping medication that might help you to sleep well, and they might also, do a routine sleep schedule for you, that at this particular time, go to bed, make sure you are in bed at this time. And also, if it is also due to medical underlying condition like epilepsy, brain tumor, brain failure, what have you, if you're too much yawning or excessive yawning is due to medical conditions such as epilepsy, brain tumor, you want to treat epilepsy, brain tumor, and whatever medical condition that they found before talking of treating the yawning. Because if you don't treat the medical condition or underlying condition that is causing you to yawn too much, of course you cannot treat the yawning on its own. You have to first of all treat the medical condition that is leading you or causing you to yawn too much. So pretty much that's all what I have. If you do have any question, please leave it in the comment section below, and I'll attend to it as soon as possible. Like I said, yawning is contagious. We've talked about the definition of yawning. We've talked about causes of yawning. What is going to trigger you to yawn? Why do we even first of all yawn in the first place? And we're going to talk. We already talked about some questions and answer. Is yawning contagious? can I stop yawning once I have begun yawning? I've answered those questions, and also I've talked about the diagnostics and this last one that I gave as treatment. So remember to see your doctor. Talk to your doctor if you have any concern, any medical concern. Talk to your doctor, because he is able to help you, or she, provided you have a he or she, is going to help you to walk through it and, you know, get back to normal. And, you know, I always wish you the best when it comes to your health, because I believe, I'm one of those people who believe your health is your wealth. I don't care how rich you are, I don't care how poor you are. If you're having a healthy body, a healthy lifestyle, you are good to go. Because believe you me or not, there are a lot of people out there who have the money, but they don't have a good health, and, you know, they're crying because the health is not there for them to enjoy what they already have. So please take your health very, very seriously, because where anybody cannot take you, good health is gonna, you know, keep you going and, you know, make you functional for the rest of the time. So please, that's pretty much all what I have for you guys today. If you do have any question, please leave it in the comment section. Please don't forget to like, subscribe, and turn on your notification bell, so that way you'll be notified whenever Stephanie Agbonkwa upload a new video. Please don't forget to share. It might be of help to somebody. Thank you for watching. I will see you guys in the next video. Bye.